meeting of the Emergency Medical Care Committee to order. And we get roll call and introductions.
All right, roll call for introductions. Carla Spencer, Paul Wood, Marie Lutz, Chris Borkin,
Here.
Will Hiller, Sam Klemick, John Anthony,
Here.
Jody Schaefer said she'd be absent today, Harry Robbins. Alternates, Cheryl Getz,
Here.
Joe Cafaro, Noah Hawthorne. Let's see, Mike DeLeo, you're on the list.
Present on Zoom.
Thank you. Okay, ex officio members, Teresa Rios.
Here. Here.
Thank you. And last but not least, Kelsey Scanlon not here. So, thank you. Those who are not members who would like to introduce their presence. Start in the room.
Dan Malister, retired EMT. We get thank you. Speak up. Use your command.
Oh, Shane Strong, Office of County Council.
Thank you. Stephen Chrissy, Salinas Fire.
Rachel Nealand, AMRCES.
Ben Hitchcock, AMRCES.
Ben Turner, Active Transport.
Online guests.
Heather Taher, AMR.
Cameron Silber, AMR.
Emmanuel Vega, Greenfield Fire.
Justin Reyes, Monterey County Regional Fire.
Greg Greenlee, Monterey Fire, and Silas Fisher, Monterey Fire will be joining shortly.
Roxanne Seabrissett, EMS Agency.
Doug Farrar, Hospital Council.
Okay, any others online? I think we have everybody. Agency staff, I'm Steve Brooks.
Karina, EMS Agency. Kimberly Hernandez, EMS Agency.
Blake Anderson with the EMS Agency.
Deborah Hopgood, also with the EMS Agency.
Annie Brereton. Annie Brereton with County Council.
John Burley, EMS Agency.
Very good. Thank you very much.
Next, we'll move on to public comment. Any member of the public may address the committee for a period of not to exceed 3 minutes on any issue not on the committee's agenda. The EMCC will listen to all communications, but may not take action. Anyone in the room first? Anyone on Zoom? Raise your hand.
Looks like Greg Greenlee.
Greg Greenlee.
Yeah, good morning. We shared it with the morning meeting, but we just want to share with this committee as well that the city of Carmel has formally requested Monterey to provide a proposal for staffing their ambulance for services in the city of Carmel. And we've reached out to the EMS agency to begin those, the procedures or process to get that completed. And we look forward to a smooth process.
Thank you, Greg. Anyone else on the Zoom? All right, thank you. We'll move on to approval of past EMC meeting minutes.
Full approval in March 12th meeting minutes.
I have an approval from Harry Robbins in a second.
I'll second.
Second from Cheryl Getz. All in favor, signify by saying aye. All opposed? And I will abstain as I was not here, so that's carried. Okay, section 4, standing reports. Director Rios, you have the floor.
Thank you. My report will be briefed. We have one of our, some of our major activities recently had been updating the designation agreements for STEMI stroke receiving hospital and base hospital. The RFP for the ambulance services continues to move forward. We are on track based on the calendar of events that was published with the RFP, culminating with the approval of the agreement scheduled to go to the board late June, early July. Thank you.
Thank you.
If someone wants to comment, it's just a report.
All right, and next from the EMS Medical Director, Dr. Burley.
Thank you. We met at the Clinical Care Committee just prior to this meeting, and just a few updates from that meeting. We heard from Steve Brooks with an update regarding the 2025 Policy and Protocol Review Cycle, which goes into effect July 1. That's moving along, and agencies should have received training documents for our policy and protocol updates. We also heard from Blake Anderson regarding buprenorphine local optional scope of practice, and we had learned that implementation of buprenorphine has continued to improve over the course of time, and since the turn of the year, we're seeing more use of buprenorphine in the field, which is encouraging. We had heard a little bit again from Steve about the 2026 Policy and Protocol Review Cycle, which was we released a list of the policy and protocols that are up for review. So you should have received those, and we'll have a public comment period opening August 4th that goes for about 11 months. And so there'll be ample opportunity for public comment regarding the 2026 Policy and Protocol Review Cycle. We also had a discussion about the use of glucometers by emergency medical responders, and particularly in rural areas. And there was a request that we take a look at that. We're going to go to the state to see if there are any obstacles to that, and see if we can move forward with that. And then we had a discussion regarding in-hospital intubation for paramedics as ongoing training, and some of the potential obstacles with that. But we'll be working with county council and local hospitals to see if there are any opportunities there, as well as with the medical examiner's office to see if there might be opportunities there as well. Those were the primary things from the CCC meeting. And if there's any questions, I'm happy to answer those.
All right, thank you, Dr. Burley. Next will be the Mohawk report with Deborah Hobgood.
Good morning, everybody. We have been working throughout the end of March, sort of early April, on the medical response surge exercise that's sponsored by the Healthcare Coalition that we are a part of. We also work with San Benito's Healthcare Coalition on that. So we had a final planning meeting at the end of March. We actually held the exercise in early April. That involved participation from everybody from the EMS agency, public health, all 4 of the hospitals in the county, the hospital in San Benito County, San Benito's public health, and AMR as well. It was a great opportunity to test our system's ability to handle multiple large-scale incidents and a surge of patients coming into the system, both EMS and directly into the hospital. So we just yesterday held the after-action review meeting. That was very positive. Lots of things that we handled well, and capabilities that we've developed within the system. We did, of course, identify some opportunities for improvement, as we always do and should. There are some specific things related to just kind of more education for the facilities about the Mohawk program, and what resources and capabilities it has, how to access that sort of thing. So we'll be working with the healthcare coalitions to bring that information on both our Mohawk program as well as San Benito's to the healthcare coalition in the future. We are also scheduled to participate in the Nacimiento Dam functional exercise that's coming up. We've got some training this week related to that, working with the Department of Emergency Management, and then the exercise taking place next Thursday. And then finally, I will say that at the end of May, EMS agency staff will be attending the MSAC conference, and there is a course related to emergency preparedness, sort of management capabilities, and increasing robustness of response to incidents that everyone will be participating in. So I think that'll be good training for our staff. So that's all I have, unless anybody has any questions.
Yeah, Deborah, Chief Reyes from Regional Fire, I have a question.
Sure, go ahead.
And you can tell me if this doesn't fall into the Mohawk, but a couple of weeks ago, you sent an email out and it was just for a drill for a strike team of ambulances that Alameda was requesting. I know I responded back saying that we could provide a strike team leader and an ambulance for said strike team for the drill. We just went through our Cal OES refresher last week, and one of the questions we asked the OES chief was, being that we're all risk strike team leaders, do we wanted to make sure that, you know, when we cross over the ambulance realm, that we were essentially qualified. The Cal OES got back to me a couple days ago and said that they don't have a position on it either way. So I guess I'm looking for some guidance from our county of, do you guys deem us qualified as ambulance strike team leaders, since the classes and certs that we go are all risk?
My understanding of the program is that the state EMS authority is responsible for the ambulance strike team leader positions and the actual formation of the ambulance strike team. So it's run outside of Cal OES within and underneath their authority. They do have specific ambulance strike team leader courses. And then they have task books that need to be completed in order to become qualified to be an ambulance strike team leader. I am not familiar enough with the Cal OES side of things to know how exactly those line up and compare. But I am happy to reach out to our regional representatives and see their stance on that, and whether there's enough of a crossover that it's sufficient to meet those requirements.
Yeah, I'd appreciate that if you can get back to us on that one. Thank you.
Okay. Yep, absolutely. Yes, sir.
Yeah, I'd appreciate that, especially since there is a complete mechanism for not only assembling those, but administering those and also reimbursing under the CFAA and contract agreements. So if that's not addressed somewhere in EMS policy, we need to know about that.
Yeah, EMS authority has their own mechanisms to do that as well, specific to the ambulance strike teams, and we worked with those during the Pajaro floods. We did have a strike team come into the county, so, but that was completely outside of Cal OES. So I'll just need to follow up and get this position. Any other questions? All right.
Thank you, Deborah. Next, we have the EMS system performance metrics, communication systems. Kimberly Hernandez.
Good morning. First, the communication systems testing, you have a 800 megahertz radio system testing report and ReadyNet MCI drill included in your agenda packet. Note that for the 800 megahertz testing was suspended in January and February due to EMS dispatches temporary location change back to county communications building. So they couldn't move their 800 megahertz radio. However, testing was resumed in March. And for ReadyNet, that kept going because it's a web-based application, and for February and March, everything was pretty status quo. There was a dip in responsiveness from CHOMP in March. I did reach out to their base hospital coordinator to find out if it was like a certain shift or what was going on. I haven't heard anything back. And any questions on ReadyNet or 800 megahertz?
and then I can go into compliance. That's fine. All right, so contract compliance, again, that's included in your agenda packet. Only reporting February because March's compliance reporting was extended due to some downtime in March between the CAD and AMR's online compliance utility. So we will report April at July's meeting, but for February, all reportable priorities met or exceeded 90% compliance. And for MPDS, 72% of calls had a determinant code and 3% were aborted due to help arrive in February. Any questions on contract compliance? Okay, thank you.
Thank you, Kimberly. I think I have you next for the fire-based ambulance report. Oh, March and September. South County ambulance response
Yeah.
time.
Those
March.
reports
Oh,
are all
okay.
coming in September or next March.
Okay, old business, EMS ordinance revision, Deborah? That's on hold, I'm sorry. Health data exchange, Blake Anderson?
Good morning, everybody. So in your packets, you did receive a report on health data exchange. There is some updates since that has been published. I'll start off with the biggest update. As of yesterday, we were notified that Mead Memorial is now fully operational with health data exchange. So now that means all hospitals within Monterey County are now participating by directional data sharing with the EMS providers. So it's been a long time coming. We're really excited about this news. We're going to be monitoring it, seeing Me's performance. All the other hospitals have been doing very well. We've been seeing a minimum of 96% match rates with the transporting agencies. So we're glad that Me is now joined and we have all of our local hospitals operational. In addition, the other change to the report that is in your packet, due to some scheduling conflicts that we have, the next EMS data working group is going to be canceled the May 20th, and the next EMS data working group will be held on June 17th, where we hope to be able to report on what we're seeing results of Me's initial implementation for health data exchange. At this time, does anybody have any questions? Hearing none, thank you very much.
Thank you. Next item, EMS policy 3030, section 3. Steve?
That's me, unless a member of the group has something they'd like to add. This is on hold pending maybe potential changes in communications system components.
All right, thank you, Steve. Next, prison response report, Kimberly Hernandez.
Just a quick update, the prison impact data has been pulled and is being worked on by our epidemiology team. And we're still fine tuning the data, but the data has been pulled and we're reviewing it. We're hoping to have it, I'm not going to say necessarily at July, but we're hoping to have it soon.
All right, thank you. Okay, the 2024 EMS Agency Annual Report, Deborah Hobgood.
Okay, thank you. So throughout the early part of the year, EMS agency staff worked together to prepare the annual report for 2024. That was sent out to the committee members on April 29th in an attempt to give you guys some extra time to review the document, hopefully be able to provide us here with any feedback that you may have related to the document. We'll take some time to do that. And then just for the rest of the steps of the process, typically we take that report to the Board of Supervisors and do a presentation in May during EMS week, along with the proclamation that the board issues. This year, we're doing a little bit of a different take on our presentation, and we'll be bringing that to the board kind of late June, early July, as that sort of timeline sorts out. So we do have a little bit of time if there are any questions or suggestions or ideas on the annual report. So I'll open it up to the committee for any input. Okay.
Thank you.
Hearing none, we'll take that.
And I missed one we'll go back to. Next, we'll go to the 2024 EMCC Annual Report with Steve Brooks.
We needed an, on F and G,
Okay,
we need the endorsement.
I need, for the EMS Agency Annual Report, we do need to do a recommendation to move forward from the committee. Do I have a motion?
The amount of work that's gone into this is,
Microphone.
I'm sorry. Mike. The amount of work that's gone into this is quite impressive, and I think that perhaps we should consider either endorsement or some sort of comment to indicate both our appreciation for the professionalism that's gone into this and the work that the EMSA is doing. I think we'd be remiss if we did not make some sort of presentation, if you will, or endorsement to the Board of Supervisors. So I would move an appropriate endorsement from this committee.
I have a motion for an endorsement on this item from Harry. Do I have a second? Okay, all in favor, signify by saying aye.
Aye.
All opposed? Okay, motion's carried for an endorsement on the EMS Agency's Annual Report for 2024. And now we can move on to the EMCC Annual Report with Steve.
Good morning again. In your agenda packet, you would have received the draft EMCC Annual Report. The EMS Agency, based on direction from this committee, put together a draft for your consideration. We sent it out to the committee members about a week, maybe a little more than that ago. And then we also went out with the agenda packet. So we hope you've had a chance to read through it and enjoy reminiscing on what the work that was done by this committee in 2024. And at this point, this is time for discussion. Any additional items that you'd like to include in the report? Anything that you might like to have phrased differently? Otherwise, we've presented this for your consideration. And if you endorse this, because we will be looking for an endorsement, we can put it together with a nice cover page as we did last year. And we'll obtain a cover letter from the chair, and we'll have this ready to go for a final look, I think, before it goes to the board in July. So we're looking to bring this from you to the Board of Supervisors in July. So with that, open discussion, comments, questions. I can pull it up here if you would like. If you'd like me to share my screen. So this is the report. If you'd like, I can go through some of the basic details. This is the reporting period, how often the EMCC meets, a little bit about the transition in committee chair, why we're doing this based on California Health and Safety Code, listed purpose of the EMCC, there's three main things that this group reviews. We list the membership. Have both the members and the alternates, as well as any changes that were made. For example, Chief Lamborg resigned the end of last year. Spencer Harnett has resigned. We do have a replacement coming. Yes. I'm sorry. I mean. Oh, yes. I will get that corrected. And then we list the activities. Went back through the meeting minutes for the year. And of course, the reports that we received. A little discussion about the reports, what was reported to this body. Any questions regarding the reports? Continued on to the periodic reports for the fire-based providers.
Have any comments on the report so far from the committee?
Of course, we continue with the MOAC reports, CMS director reports, CMS medical director reports. And then we get to some of the discussion and action items that we dealt with this committee last year, last year in 2024. Of course, a lot of time spent South County compliance. So show the board what you guys saw. Of course, you endorsed the last year's the report for 2023, endorsed the CSA 74 disbursement. We appreciate your support for the buprenorphine program. Gives a little description about what the buprenorphine program is and does. Appreciate your support for moving the HD program along. The behavioral crisis support response in the city of Salinas and the county. Appreciate your support and recognition of the response to the mass shooting in March in King City. Some of the things that this committee is responsible to do, the Form 700 ethics course, how we meet, and a little bit that we're continuing active recruiting for membership. And that's where we're at with the report. Any comments, questions? Thanks.
I didn't know we'd done that much stuff in the past year.
Well, when you make it look easy, I don't know. But that is the report in its draft form. Again, we're looking for any suggestions, ideas, something you remember that, hey, didn't we do this that I might have missed? Whatever it is, we can add it to this and or subtract if you don't want to talk about something. But you guys did some work and we appreciate it. And so when you're ready, we would appreciate an endorsement of this. And what I'll do is, again, put a nice cover page on it. We'll get a letter from the current chair and package it up ready for a July transport to the Board of Supervisors.
Are there any deadlines that we need to meet today?
It would be nice if we had an endorsement, but I believe the July EMCC meeting will occur before the board. We'll just have to assume you guys will endorse this because we'll have to put it on the board's agenda before you would have a chance to endorse it. So ideally, we would like it today. But if you have something that you really want to look at or, maybe review, we can discuss that.
The board meets on the first. This report is due to the board in the month of July. According to the board schedule right now, the board will meet on the 1st and the 8th, and then they will meet again until August.
Then we'll need your endorsement today because I think we meet,
That's what I was driving at.
Yeah.
The timing here.
thank you.
Have a motion.
You wouldn't mind saying that into the microphone, would you?
I move to endorse.
Okay, I'll second that.
Seconded by Harry. Go to a vote. All in favor, signify by saying aye.
Aye.
All opposed? And the motion to endorse the annual report is carried. Okay, now we'll go back to my mistake. The 2025 EMCC appointment reappointments with Steve.
Pardon me for a moment while I pull up the staff report. Okay. Back to sharing my screen. All right, so again, you received this staff report within your agenda packet. This shows with highlighting the members and the positions that expire at the end of June. And so we absolutely will be needing representative organizations, a letter of recommendation to continue the position. For those who are 2026, you're free this year, but we will need this for citizen representatives. We will need your assent in writing, preferably in emails, fine, that you'd like to continue on EMCC. And so for the members, and then also for the same positions with the alternates, I'm sorry, I missed highlighting Bandy's position. So we'll be reaching out and harassing you mercilessly if you don't get us the information. Yes, Cheryl.
I believe that the fire chief endorsed me to be the primary.
They did.
Okay.
So we will need an alternate for the BLS. Awesome. Then we'll expect it tomorrow, right? Sure, we appreciate that. Cameron?
Yes, sir. I just wanted to check if you got emails from myself or Victoria Soto for the paramedic representation from the field.
We did. And we're putting that together to go to the board.
Perfect. Thank you.
Thank you. Any other comments, questions, concerns? Leanne?
Microphone.
Oh, can you?
I read an article that Steve Adams may be retiring at the end of this year, so just another consideration to have a replacement.
Okay, well, thank you for that.
Steve, the letters, sent them to two.
Microphone.
The letters expressing interest, we sent them to two different folks, I believe, when I was put on the committee.
Yes,
You want the same letters going to the same folks?
that would be great because I think, and Deborah can speak to this, I think your guys' terms may be also expiring and needing, I don't know if, I don't know, you have to do anything for CCC. So yeah, just send it to me. We'll get it in. Perfect, thanks.
Any other questions, comments, or concerns? Okay,
Thank you very much.
thank you, Steve. We have no new business this meeting. Next, any announcements for the good of the order? From the committee? Okay, hearing none, our next meeting will be Wednesday, July 9th at 10:30 a.m. And this meeting's adjourned.
Thank you, everybody, for your participation.